Our guest today is Lorraine Goddard, the CEO of United Way, Windsor and Essex County. Lorraine, welcome to the show.
Thank you for having me. Glad to be here.
Great. We always ask this question of everyone. How are you and how is your family doing?
My family and I are doing quite well. We're working from home. We're respecting the social distancing requirements. And interestingly enough, being at home every day with my husband, we're reconnecting in ways that we traditionally might not have the opportunity to. So yeah, we're doing well. Thank you for asking.
Excellent. How has COVID-19 affected the United Way staff and your operations?
Well, we have been working from home. This is our fourth week. So all the staff are working. We're leveraging technology as we are today at this interview. We've been very, very busy responding to some of the immediate impacts of COVID-19. So our team is working extremely hard, but everyone is respecting the social distancing, and I'm really happy to say that all of our staff are healthy at this time.
That's good. That's good to hear. What are the most pressing needs of our residents at this difficult time?
Well, like we would anticipate, basic needs are really top of mind for everyone. When we think about ensuring everyone has access to food, that has been kind of our first focus. We all, know we read on social media or seen in the news a real run at the grocery stores, people hoarding food and a lot of empty grocery shelves. And as a result, that really impacted the donations of food to food banks. And so we've seen a rapid decline of donations. That forced many food banks to close and also to reduce their hours. In addition to the lack of food donations, we've seen a real drop in volunteers. So many of the volunteers that help at not just food banks, but a lot of organizations are experiencing this, are older adults, right? They have time, they want to give back, but they're also most at risk for contracting COVID-19. So there is also a significant decrease in the number of volunteers. So all of that came together very, very quickly. And it was just a couple of weeks ago when we were told that we had about 10 days of food left in many of the food banks. So we had to jump into action really quickly, come up with a plan to address that. In addition to food, we know even housing, whether it's sheltering, domestic abuse shelters or shelters for homeless, ensuring that they have adequate staff and volunteer resources. We also recognize that seniors are most vulnerable to COVID-19, and they're very fearful to leave their homes. So we really need to ramp up our check-in, our seniors check-in, to make sure that they're not alone, and that if they need access to food, medication, or other things, that we are supporting them through this time. And last but definitely not least is really mental health. There's a lot of anxiety out there, and the longer that we must social distance ourselves, we can anticipate that there's going to be even a greater need for mental health services. So all of these things have really come together at the same time, and United Way with a number of partners in the community have developed a response to address these.
Great. How are essential and support service organizations, how are they managing at this time?
Day by day, I would say. It's such a fluid situation. Even like in the last couple of days, should you wear a face mask or don't you wear a face mask, right? They're really just managing day by day, and a lot has to do with stabilizing their operations, because if you think about shelters, and if COVID-19 starts to impact their staff and volunteers, people who are homeless still need a shelter. How are we going to operate those shelters? So we're also looking at can we create a database where people who, may be new graduates, younger people who want to have some work experience, where an organization, if they are being impacted by COVID-19 and it's impacting their staffing levels, that they can go and bring someone into their operations really quickly. So it's an evolving situation, and we're really just trying to problem solve and try to be as proactive as we possibly can.
Windsor and Essex is a very giving community. How can the community help you at this time?
Well, I think there's several ways that the community can help. Certainly, there's a need for additional financial resources because the needs are quickly changing, and we really need to get a handle on this and backfill. There's a gap between what the federal government and the provincial government are providing to local communities by the time we receive it, and there's an immediate need now. So anybody that has the ability to contribute financially, it's going directly to support these services in the immediacy. And we do have a web page at weareunited.com/COVID-19. Secondly, if you have the ability to volunteer, we are working with the health unit. There's specialized training and protective equipment that are being given to volunteers. You might be able to deliver a food hamper to people's homes or call a senior to check in on them. That would be wonderful. And, again, there's a Facebook page where you can go. It's We COVID Care community, something like that, COVID Care community. And you can say right on the Facebook page that you're willing to volunteer, and we have someone monitoring that Facebook page. And lastly, I would encourage people to reach out to your neighbors. Make sure they're doing okay, particularly if you have neighbors who are older adults. Not everyone has family that can support them, and we already know in our community so many of our children have had to leave the community for work, leaving their parents behind. So I would encourage people to, really reach out to their neighbors and see what they can do to help, obviously respecting social distancing and keeping yourself safe.
Yeah, great. Lastly, Lorraine, can you tell us about the Windsor-Essex Food Helpline?
Yeah, we're really so pleased that we were able to get this up and running really quickly in partnership with the Windsor-Essex COVID Care Coalition, and there's approximately about 15 organizations that have come together to work on this. And with our corporate partner, Green Shield Canada, they have a really fabulous operation there in terms of a call center where they provide support to people who are accessing their benefits and have questions about it. And they had seen a decrease in the number of calls that they were fielding for their general operations. And so we reached out to them and asked if they could help us out by establishing a helpline that they would man. And so Green Shield literally just stepped right up and said, yeah, we can absolutely do this. So within 1 week, they were able to coordinate their internal operations, the technology, and a team of staff who were trained up. And now we have people manning the telephone lines where you can call in, and if you need any emergency food assistance, you can speak to someone right away, and that there's a referral that we make sure that you call. We understand your needs, and it goes directly to either the food bank or Meals on Wheels or whatever it is. And then we have literally, I would say, a significant number of drivers from Children's Aid Society who had traditionally driven the kids that Children's Aid are supporting to appointments and things like that. They have stepped up and said, hey, we can help deliver these grocery gift cards and food boxes. Let us know what you need. So we're just so, as you said, so overwhelmed with the generosity of our partners and whether they're private sector or public sector, individual donors. It really is a testament to what a caring community we have here in Windsor-Essex.
Great. And the phone number is, in case anyone's interested in that?
It's 1-888-488-1578. And feel free to call. It's open from 8:30 in the morning to 8:30 in the evening. However, it will be closed down and it's Monday to Friday, but it will be closed down Good Friday through Easter Monday. So if anyone is going to need assistance, and if this is airing on the Thursday, I would encourage you to reach out immediately so that we can make sure that you're accessing food over the long weekend.
Excellent. Thank you, Lorraine. We really appreciate your time. Please extend our best wishes to you and your staff. Please stay well and stay safe.
And same to you and your staff, Robert. Thank you very much. And everyone else in the community, stay safe.